Vitamin D plays a vital role in keeping our immune system strong and ensuring our bones stay healthy by helping us absorb calcium. Sadly, many adults aren't getting enough of it, leading to what's known as vitamin D deficiency. This shortage can result in various health issues over time, including diabetes, heart disease, immune system problems, and even cancer. According to a 2022 review, half of the whole world doesn't have enough vitamin D, and in the US, 35% of grown-ups have the same problem. It's really important to know the signs of vitamin D deficiency so we can prevent these problems. In this video, we'll discuss these common signs in detail. You'll be surprised by some of the signs we'll cover, so keep watching till the end. Sign number 1. Weakened immune system. Using sunscreen is important for protecting our skin, but it can also reduce the amount of vitamin D we make. Additionally, many people don't get enough sun exposure to make sufficient vitamin D. This is especially true for older adults, as their bodies become less efficient at making vitamin D from sunlight as they get older. Having enough vitamin D is important for a strong immune system. It can help protect against illnesses like the flu and common cold. However, if you often get sick, it doesn't necessarily mean you have low levels of vitamin D. Having low vitamin D levels can slow down the recovery process though. When our immune system is weakened due to a lack of vitamin D, it can take longer to recover from illnesses. So, paying attention to your vitamin D levels can support your overall health. Sign number 2. Low energy levels. When it comes to feeling low on energy, there can be various reasons behind it. Poor eating habits, not getting enough exercise, and dealing with excessive stress are some factors to consider. Additionally, it's worth noting that not getting enough vitamin D can also contribute to this issue. Vitamin D is essential for the overall well-being of our body, affecting not only our bones and muscles, but also our entire system. If we don't have sufficient levels of this vitamin, we may experience extreme tiredness and fatigue. This may manifest as feeling tired during the day, even if we're generally healthy, or it could result in overwhelming exhaustion for individuals with chronic diseases or autoimmune conditions. If you're experiencing any of these symptoms, it might be a good idea to speak with a healthcare professional and consider getting tested for vitamin D deficiency, as it can provide helpful insights regarding your energy levels. Sign number 3. Weakened bones. Maintaining the strength and health of our bones requires a careful balance of essential nutrients such as vitamin D, calcium, magnesium, and vitamin K. Vitamin D plays a crucial role in facilitating the absorption of calcium from our diet. Calcium, in turn, is vital for maintaining the integrity of our bones and teeth. However, when our bodies lack sufficient vitamin D, the absorption of calcium becomes compromised. As a result, our bodies resort to extracting calcium from our bones, leading to a weakening and brittleness in their structure. This can result in a range of bone-related ailments, including an increased propensity for fractures, the development of osteoporosis, and in rare instances, a condition known as rickets. Over time, weakened bones can significantly increase the risk of falls, fractures, and the onset of various other bone disorders. Before we proceed to the next surprising sign of vitamin D deficiency, be sure to hit the subscribe button. Sign number 4. Mood swings. Vitamin D, often referred to as the sunshine vitamin, acts as an influential steroid hormone in the body, playing a pivotal role in regulating more than 200 genes. It's no surprise then that a deficiency in vitamin D can lead to mood swings, which are commonly experienced by those lacking optimal levels of this essential nutrient. Hormones, acting as messengers, have a profound impact on brain, heart, and organ health. When vitamin D is insufficient, individuals, especially women whose hormones fluctuate significantly each month, are more susceptible to experiencing frequent mood swings. However, contrary to the belief that mood swings are inevitable and uncontrollable, it's essential to recognize that a lack of vitamin D may also contribute to seasonal affective disorder, SAD. This form of depression tends to manifest during the colder months when sunlight exposure is limited, further emphasizing the importance of maintaining adequate vitamin D levels for a balanced mood. Sign number 5. Poor vision. Having low vitamin D levels can affect your eyesight. When your body doesn't get enough of this important nutrient, it can make it harder for your eyes to adjust to different levels of light. This means that when you enter a dark room, your pupils won't contract as they should. making your eyes more susceptible to sensitivity and bright light conditions. Getting enough vitamin D is really important for keeping your eyes healthy. Some studies have shown that low vitamin D levels might increase your chances of having age-related macular degeneration, which is a common cause of vision loss in older people. In fact, research suggests that people with low vitamin D are almost twice as likely to have poor vision. Shockingly, about 20% of people with low vitamin D have problems with their vision. Sign number 6. Mouth ulcers. The mouth can serve as a valuable indicator if you suspect a deficiency in vitamin D. Insufficient levels of this essential nutrient can manifest in the form of mouth ulcers, also known as canker sores. These ulcers are small sores that can develop on the inner or outer surfaces of the mouth, causing discomfort and pain. They often appear as red or white patches and can persist for varying durations, ranging from a few days to several weeks. In cases where adequate dental hygiene is maintained and recurring mouth ulcers persist, it wouldn't hurt to ascertain your vitamin D levels. Checking your levels can provide valuable insights into whether a deficiency of this crucial vitamin is contributing to the formation of mouth ulcers. Remember, understanding your body and seeking professional advice can help address any concerns you may have regarding mouth ulcers or other health-related issues. Sign number 7. Dry skin. Inadequate levels of vitamin D can cause dry skin, which is a common symptom of this deficiency. This condition is characterized by rough or scaly skin that may resemble eczema or dandruff and may feel itchy or uncomfortable. Recent studies indicate that vitamin D deficiency may be linked to dry skin conditions like eczema and psoriasis. Additionally, vitamin D deficiency can contribute to a skin disorder called ichthyosis, which results in dry, scaly skin. While this condition can affect people of any age, it is more common in younger individuals and may be limited only to the skin or associated with other medical conditions. To alleviate symptoms of dry skin, increasing the amount of vitamin D in your diet can help provide the skin with extra moisture and prevent frequent dryness. Sign number 8. Bleeding gums. Bleeding gums can occur for various reasons, and it's important to address the underlying cause. One common factor is inadequate dental hygiene, where improper brushing or flossing can lead to bacterial buildup and subsequent gum inflammation. Additionally, certain medications can have side effects that may contribute to gum bleeding. Another potential factor is a deficiency in vitamin D. This essential nutrient plays a role in the production of new blood cells in the body. Insufficient vitamin D levels can hinder this process, leading to a decrease in blood cell production and potentially causing anemia and bleeding gums during oral care routines. To determine if a vitamin D deficiency is present, it is advised to consult a healthcare professional specializing in nutrition or integrative medicine, such as an acupuncturist or naturopath. They can conduct appropriate tests and provide personalized guidance on improving your vitamin D levels. Sign number 9. Muscle spasms. A deficiency in vitamin D can lead to muscle spasms and weakness, which are common symptoms associated with this lack of nutrients. Although muscle cramps are often cited as the primary sign of insufficient vitamin D, it is important to recognize that low levels of this crucial vitamin can result in other complications. For example, vitamin D deficiency has been linked to paralysis and weakness in addition to muscle pain. This deficiency is also implicated in multiple sclerosis, MS, a medical condition that causes inflammation and nerve damage in the brain and spinal cord, leading to muscle pain and weakness. The connection between vitamin D deficiency and multiple sclerosis was initially discovered by scientists in Denmark, who observed that people living in higher latitudes with less sun exposure were more likely to develop multiple sclerosis. Since then, numerous studies have further validated these findings, indicating that low levels of vitamin D increase the risk of developing multiple sclerosis compared to individuals with normal levels of vitamin D. To maintain optimal muscle health, it is necessary to ensure that you have adequate levels of vitamin D, as well as other essential nutrients such as magnesium, vitamin K, and calcium, which are all crucial for optimal absorption. Thank you for watching, and make sure to watch more amazing videos from our channel.